All right. Hello, good afternoon. My name is Mark McKenzie. I'm the Vice President of Business Development, and I am really excited and thank you guys for registering for, frankly, this webinar that I've been looking very forward to hosting with a prominent figure in not only urgent care space, but the healthcare community as well. She's received her master's at Harvard in Healthcare Administration and Management, and is also an instructor at Harvard, where she's currently the Chief Medical Officer of the largest urgent care, one of the largest urgent care groups in the nation at Fast Pace Health. Dr. Sarika Agarwal, thank you so much for joining today, Dr. Agarwal. How are you?
Good. Thank you so much. Excited to be here and participate in this webinar.
Yeah, so the title of the webinar, Bridging the Gap Between Practice and Profession, really going to uncover the mind of a clinical leader in Dr. Agarwal. So we're excited to dig in. And for this webinar, we're actually going to address 4 components. And so we're going to first look at people, then process, technology, and then change, and the effects through the lens of Dr. Agarwal and her expertise. So we're excited to move forward. And with that, I'll jump in. Bridging the gap between practice and profession, reimagining clinical decision support in urgent care. All right, so the first component is people, administrative staff and clinicians. So Dr. Agarwal, if you would be so kind, how can AI help? I've got about 3 questions here as we look at this slide. One, how can AI help clinicians and operations? But want to first get to, is AI all hype? And I'll leave with those 2 questions, but I just want to caveat, for anyone reading the slide, CDSS is Clinical Decision Support System. So with that, Dr. Agarwal, I'll give you the floor.
Thank you. So one of the biggest issues, which I think any clinical leader is seeing across the US right now, especially after COVID, is the provider burnout. And this is I should actually say clinical staff burnout, because both the staff that supports the provider and the provider face the same challenges. A lot of these are just administrative challenges, from registration of the patient to the EHR work, a lot of it repetitious, to the computerization of healthcare, as I like to call it, all leading to, I think, burnout, which leads to dissatisfaction, which really leads to unsafe patient care. You want both the staff and the provider to be engaged and energetic, really, and ready to treat all the maladies of health. And so I think that is a big piece of this. What are the things that we can do in terms of people? And, I think that a lot of you out there are doing these, is really reducing the clicks, reducing that computerization. Yeah, clinical decision support systems, both with AI and without, however they may be, can really enable this process. And they can really reduce the time and increase the automation and really help the provider. The big piece is that they have to be incorporated into the workflow. And this is something I learned when I was at Geisinger. It was, a mantra. Like I always follow very diligently in the work that I do. It says reduce no value added work, automate, delegate, so that the people are doing work at their license, incorporate into the workflow, and activate, which is the activation of patient and staff. And so I try to use this mantra everywhere that I can. Some of the clinical decision support systems that we use in the urgent care setting, a lot of our urgent care providers are doing differential diagnosis for acute episodes all the time. Yeah. And it's usually repetitious, as about 80% of the complaints that come into urgent care are about 15 to 30 different chief complaints. So what we have done is we've actually automated the differential diagnosis for these complaints. We've taken evidence-based differentials and we've automated that. And that's one of the ways where we've helped this clinician really move down that process and reduce the effort, increase the efficiency and reduce the time.
Yeah. Okay. Excellent. Yeah. I think, from an operational standpoint, I don't speak for clinicians, but I've been in operations, so I understand, if we can get more efficient on our processes and that can help the clinical get more efficient, the clinical team get more efficient on their practices, then I think that is starting to, tell a better story in terms of how AI is able to help, because we're now helping both operations and clinicians. All right. Go to the next slide here. All right, so the next component is process. This, everybody wants seamless incorporation, but, I would say, Dr. Agarwal, what technology exists that can assist both operations with perhaps the patient journey, and then also assist the provider with the clinician journey of each visit? And then another question below that, if you think about, what are the drivers, or what drives the best patient experience, I beg your pardon, best patient outcomes?
So I really think that there's a lot out there in terms of, really getting this incorporated into the workflow. I think the big thing that this is really important for most clinicians is whatever technology and whatever flow that you have, you don't want it to be separate. You really want it to be integrated. And the problem with our EHRs, the way they were built, is they really weren't built to integrate, different things. And so ideally what you want is whatever you do either should be built in, whether it is macros in, notes in the drop down, or that, can be standardized and evidence-based, or using, the A-Scribe, which a lot of organizations are doing. Yeah. But even that may not necessarily standardize things. I really believe that documentation, and in fact, all treatment should be customized to the patient, but standardized to the clinician. Whereas the way it is now, I think in a lot of healthcare cases, it's really customized to the provider. It's what each provider is doing for the patient versus getting customized to the patient. So to the extent that you can standardize some things and make them efficient, this includes, like I said, documentation. I think that would definitely help in the efficiency and help in the flow. And the object behind all of this is, again, that you don't just make it efficient, but you make it easy enough for the provider to follow so that, they are satisfied, because we talked about that. There should be provider satisfaction really for patient satisfaction. And so that really means that make sure that it happens while they're doing the work, when they are doing the work, and make sure you can automate as much as possible or make it efficient using either AI or other technology to do that. The other important thing is, as you're doing this, a lot of the EHRs now have a lot of pop-ups, and there is that fatigue that happens. And so you might think, okay, I'm going to make everything a click. And I actually tried that. When we were trying to automate this differential diagnosis, what we did was for each chief complaint, we automated, say, 4 evidence-based differential diagnosis. Then we said, okay, you evaluate them. So that was 4 clicks. That you had to evaluate each by. Then we had the medical decision making. There was a click for that. Then we had click for the actual documentation. That's a lot of clicks. And so we talked to our providers, and they said, ask them how much they can live with. And what we realized is that as we did this flow, we could actually bring all of the stable conditions into one click and the exacerbated conditions into one click in terms of the documentation they needed. And so we were able to then re-look at that process and reduce the number of clicks. And I will tell you, that is a big source of satisfaction to our providers, plus increasing efficiency and really thinking about the number of clicks that they actually do. The processes need to make sure that we minimize the number of clicks that they are doing, because more clicks means more time in front of the computer, again, speaking to that computerization, and less time with the patient.
Yeah. Yeah. So then I would say then that would help drive those better patient outcomes, or toward the best patient outcomes. Would you agree?
Absolutely. Again, all of this, really everything that you do, my true north is always a great patient journey, patient satisfaction, and improved health outcomes. That is why I am a provider, and that is why I'm a leader of a provider organization. So our true north is always leading to that. It's really walking backwards from it, the way I think about it. Walking backwards, what are the things that prevent us in that people, process, technology realm, and how can we help improve that so that we help that whole patient and provider, because they're interconnected, patient and provider journey.
Well, and I think just to kind of dovetail on what you said earlier was the differential diagnosis, about 80% of that could be automated. Is that what I heard?
Yes, we can. What I said was 80% of the differential diagnosis, we have some 80% of the symptoms that occur, chief
Symptoms,
complaints in
okay.
the emergency room,
Yeah.
in the urgent care, and maybe even in a provider practice, they tend to be these top diagnoses. And so
Yeah.
you could look at evidence-based differentials for them, for these chief complaints, and really automate that. And that's what we did. We took about, 1,000 different symptoms, and we took, a bunch of differential diagnosis, and we sort of mapped them out and built this clinical decision support system.
Okay, excellent. All right, so let's move on to technology as the third component. Complexity risk, we talk about an XDON advantage with regard to technology. As you guys probably know, XDON is a technology solution company geared around the healthcare sector in terms of coding, billing, and revenue cycle management. And so out of that, we're able to layer in AI where appropriate and really kind of drive down administrative burden for these clinicians, get folks in the urgent care setting paid faster and quicker to cash. So that being said, I will pose this question, which is, out of technology or whatever could be born with technology, would it be helpful if clinical documentation improvement, or CDI, could be real time, while you're in there with the patient or during a visit?
So again, as we mentioned, right through, you want every aspect of change or every transformation that you do of the clinical journey to be, in time. The provider, it really needs to happen while the provider is doing that aspect.
Yeah.
And so same, very sort of the CDI, or the documentation efforts, follow that rule. It really needs to happen when the provider is doing their medical decision making and doing their documentation. In the past, and I've gone through the gamut of this as a leader and as a provider, we would get, sort of after the fact, a coder would look at our documentation, give us feedback, then we would go back in and we would, make the addendums, and we would do this appropriately. Well, that really is not ideal. And it doesn't teach as much as, because remember, what you want to do is not only do you want to get that feedback in real time, but you also learn better when that feedback is in real time. That teaching moment, and this goes for teaching wherever it is, if you teach in the moment, the lesson sinks more and it helps you for the next time. And so real-time feedback, and in this new world, it can be AI generated, is really important for the provider to then make the appropriate changes to their medical decision making, as well as their notes and their documentation. And this works for, whether it's related to the E&M and acute visits, or it's related to, chronic visit documentation. So I really think that that is important. And I have worked with XDion sort of in this space. And we really feel like that real-time feedback helps providers in working through this process.
Great. All right. And then last slide, and we are humming. We're only 15 minutes in, so we may be able to give some time back on calendars. But this last component is change, right? The cause and effect. And, a couple of questions that I would probably raise to you, Dr. Agarwal, would be, one is, how can operators and clinicians best adopt technology that assists them? And then what would be the driving force for clinicians to either accept that or rebel? And I'll maybe let you kind of think through, what that would be.
So I think that most people who've gone through transformation and change, gone through their journey, they go through sort of similar steps. I think as a clinician, you really have to give the why. This is very important, and this can be based. The why can be based on the audience. It can be the patient story, the patient journey, but you really have to look at the audience in terms of why. And the way I think about providers, it's hearts, minds, wallet, and time. Those are the three big ways that I think about the why. The hearts is really sort of the patient journey. The minds is really, how it affects their professional responsibilities, their role and responsibilities, and really speaking to that, their roles in the organization, in compliance, the regulatory guidelines, all of those things, their license. Important to give the why in terms of compliance and their license. Providers, really, the license is their identity, and I mean professional license, not just driving license. So really speaking to the why. The what part of it is that efficiency that you build into the people, process, technology is really building an efficient process. And the way you do, I believe in rapid PDSA cycles. I believe that, you get the stakeholders together, the SWAT team, like I like to call it. I have a SWAT team. These are my thinkers, my early adopters. They're not necessarily people that we've paid to do this, but they're just the people who are always revved up. And so I have a SWAT team of stakeholders. They're the people who influence others. They may not be leaders, but they are my people that I go to. I run this by them. I get them to approve about the initial process, and then they are the ones that are willing to implement it. So they are my early adopters, and through them, then I get to the majority. Through them, I get to the majority. And then finally, when I get there, we hardwire it, because no process is great unless it is sustainable. So you really need to make sure that it gets hardwired, it gets incorporated in there. And that requires that dissemination across. And you only know it's hardwired when you go through, months where it stays, you get your metrics that continue to go through and continue to get sustained. And how do I think about the metrics? I always think about, I look at balanced scorecards of metrics. I look at operational metrics. I look at quality metrics to get to your outcomes. I look at strategic metrics, and then I look at financial metrics. So really looking at all of the different pieces where for any project, how do we bring those metrics, and then how do we operate those metrics? But I would say the key piece to any project is your early adopters, your champions, your SWAT team. If they buy in, they can indirectly influence others, and they can cause that wave effect to get that majority. And then you have those outliers. And those, what we do is we do one-ones, and we keep trying to reduce the number of outliers. So I get to that 80%, my first 10% champions, my 70% or 80% of that majority. And then my outliers, I try to diminish those to under 10%. And I keep working through them. Some of them, it used to be when I was younger, I would try to conquer those. Now I just try, but I don't put all my energies on them, because sometimes I can never get them to go. So that's sort of my change process. And I think that, the way I like to think about it, I've always worked and always been able to affect change. What it is it's never complete. It's all an ongoing process. And my journey is always to get to a greater majority rather than to get to a lesser outlier or minority. That's where I aim now. And that's how I go forth.
Very good. Yeah, I think, building those champions in and that top-down approach where, leadership supports it, your internal champions support it. And so by delivering it that way is probably more compelling than, just a hope and a prayer. Yeah. Well, very good. Those are the four components that we talked about: people, process, technology, and change. And so out of that, we really have a call to action and would likely just open the floor up to some Q&A. If you guys do have questions, certainly throw those in the Q&A portion of the meeting, and we'll certainly get to those. This particular slide, and we can take this separate from this webinar, but we can certainly drill down into how, clinical decision support system is an asset, how we're removing administrative burden from operations and clinicians, and then, just that ability for technology to partner with you. Certainly something that Extion does today and is doing. So, in certainly concert with what we've done and help with Dr. Agarwal as well. So it's certainly an iterative process, and to get the clinical knowledge to be able to impart that wisdom to our team has been invaluable. And so I think we're getting, markedly better as time goes on. But I'll pause there and look in the chat and see if there are some questions, and we can get to those.
It says chat is turned off for this meeting, so I'm not sure if people can post questions in the chat.
Yeah, not chat, but Q&A Q&A is open.
Okay.
So yeah,
Okay.
if there's,
I didn't know if people could write in the chat.
Yeah,
That's how
they can't write in
I
the chat. Yeah, it was, yeah, we were holding that hostage for minimal
Okay.
disruption.
Well, happy to answer any questions. Certainly I'm available now, but also otherwise, if any questions are sent to the meeting organizers, I'm happy to answer them.
Yeah, and we may have, a system where they can just reach out individually as well. So I can actually just, share this slide again and then look at the, let's see. And here's a way to reach out. Any of these, the info@Extion Health works. And I'll follow this up with an email to all the participants